Good morning, all. Today we are going to see about the condition dengue fever. So it's if we all know about what is by dengue fever. So it is also known as the breakthrough fever. Is an infectious tropical disease caused by the dengue virus. Dengue fever is caused by the dengue virus. So epidemiology, the mortality is about 1 to 5 percentage without treatment, less than 1 percentage with adequate treatment. However, severe disease carries mortality about 26 percentage of. Dengue is the endemic, is more than 110 countries. It's infect 5 to 100 million people worldwide a year, leading of million hospitalization and approximately 12,500 to 25,000 deaths can occur a year. So this is all about the epidemiology. And next, so dengue fever virus is an RNA virus of family Flaviviridae. So dengue family is a Flaviviridae. Generic name is Flavivirus. Most of it is transmitted by the arthropods. Arthropod, which means the mosquito and ticks that may cause the transmitted the diseases, and or the therefore also referred to the arbovirus, which means the arthropod borne virus. So as I said before, it's an RNA group of virus. The family is Flaviviridae. Flavivirus that cause the DNA. It's an arthropod, mosquitoes and the ticks that may transmit the viruses. There are 4 types of virus are there, which are they called serotype, and these refer to the dengue V1, dengue V2, dengue V3 and dengue V4. All 4 serotypes cause full spectrum of the disease. Infection with is one of the serotype immunity, that's but only short term protections against other diseases. So there is a 4 types of virus are there: den 1, den 2, den 3, den 4 and den 4. So it may cause the different types of immunity. And the next, transmission. And when we say about the dengue transmission, is all about the mosquito with an genus Aedes, and principally Aedes aegypti, that may cause the transmit the virus. Dengue virus is primarily transmitted with the ADA mosquitoes, particularly in Aedes aegypti. The mosquitoes usually live between the altitude area, that is the north and 35 south below the elevation of the 1000 meters. The bite primarily during the day. So dengue and other Aedes species transmit the disease include the Aedes albopictus and then Aedes polyestiensis and then Aedes culturaceus. Human are primarily caused of this virus, and but it also circulates the non-human primates. I think people are about know about the transmission of disease, and infections can occur via the single bite. The female mosquito take blood meal from a person infected with the dengue fever, become itself infected with the virus, causes the lining in the guts. About 8 to 10 days, the virus spread other tissues, including the mosquito salivary gland. The suspected lesion with the saliva. And next mechanism, when a mosquito is carrying the dengue virus bites a person, a virus enters in the skin together within the mosquito saliva. It binds the entire white blood cells and reproduce the inside the cells which they move throughout the body. So I think people are understand what's happening here. In severe infection, the virus production inside the body greatly increased, and more organs such as liver and bone marrow can be affected, and fluid from the bloodstream leaks through the wall of the blood vessels into the blood cavities. And next, so once it's entered the blood cavities, as a result of less blood circulation in the blood vessels and the blood pressures becomes low, it cannot supply the sufficient blood to the vital organs. Furthermore, the dysfunction of bone marrow leads to the reduced number of platelets, which leads to effective the blood clotting. So there is a decrease in platelets count. So here next, signs and symptoms. When I seen the signs and symptoms completely asymptomatic for a few days, mild symptoms such as an uncomplicated fever, 80% of people they experience, and the most severe illness 5%, and a small proportion of life threatening. The incubation period is about ranges from 3 to 14 days. The characteristic symptoms about dengue: the sudden onset of fever. The patients may experience a headache, muscles and joint pain, rash. The alternative name of the dengue is otherwise called the break bone fever. It comes associated with the muscles and joint pain. Patients having severe joint pains, and the symptoms include fever, headache, muscles and joint pain, and characteristic skin rash similar to the measles. So, and next, in small proportion cases, disease develops into the life-threatening dengue hemorrhagic fever, resulting in bleeding, low level of blood platelets, and then plasma levels. So, warning signs: abdominal pain, ongoing vomiting, liver enlargement, mucosal bleeding, high hematocrit with the low platelets. So, here the main symptom is this patient is having low platelets count is become very less, and the patient is experiencing the lethargy. I think people understand what are the warning signs in the dengue fever. And next we move. Other signs includes that the whole infections having the three phases. First phase is febrile phase, and second phase is critical phase, and third phase is the recovery phase. These are the three phases in infection. So first phase is about the febrile phase, and second phase is about the critical, and third one is the recovery phase. Let's see in first phase, that's a febrile phase. So febrile, which means the high fever, are about 40 degrees Celsius by basic nature, breaking the rating in 1 or 2 days. So the patient is experiencing high fever around 104 degree Fahrenheit, and the patient is having the generalized pain, headache, usually last 2 to 7 days the pain will be there. This is about the febrile phase. And next we move on the So next about rashes occur first second days of symptoms. The flushed skin will be there. In later houses, the illness about 4 to 7 days. Measles like rashes the patient is having this throughout the body. They have the rash. Some petechiae will be there, which means petechiae means small red spot that do not disappear the skin breast, which caused by the broken of the capillaries can appear. So the picture, so the petechiae purple color, the color changes will be there in the skin. As some mild bleeding in the mucosal membrane, mouth and nose. So we can see in the mucosal bleeding. So due to why the bleeding is here, the platelets become very less, so which may cause the bleeding. And in critical phase, the critical phase which follows the resolution of high fever typically lasts 1 to 2 days after the febrile phase. And next about during this phase, there may be the significant fluid accumulation in the chest and the abdominal cavity due to increased capillary permeability and then leakage. So here the fluid leakage will be there in the especially in the abdominal and the chest cavity. This leads to the depression of the fluid circulation, so decreased blood flow supply the vital organs. So there is the fluid leakage will be there, so that may cause the decreased blood supply to the vital organs such as kidney, oil, heart, and then other organs. They have in the decreased amount of blood circulations, so it may cause the organ dysfunction and then severe bleeding, typically the gastrointestinal tract, so especially the gastrointestinal. So it may lead to the shock syndrome in patients. So here dengue shock syndrome and hemorrhagic dengue fever occur in the less than 5% in dengue. However, those having the previously infected with other serotype dengue. And the next one is the recovery phase. In recovery phase is about the leaked fluid, reception of the leaked fluid in the bloodstream. So once the patient is recovery phase, already I said the blood leakage from the blood capillaries. So here the reception of fluid will be there. This is usually occur 2 to 3 days. Severe itching and slow heart rate will be there here. During this stage, fluid overload state may occur. It may affect the brain and then reduce the consciousness and the seizure. Some patients may experience the seizure. So associated problem, dengue can occasionally affect several other body or system. A decreased level of consciousness, infection in the brain due to the virus, indirectly as a result of impairment of the vital organ, example the liver, other neurological disorder, transverse myelitis, Guillain-Barré syndrome, infection of the heart, and then acute liver failure we can see in these patients. And then classification. So here the World Health Organization, it will be defined dengue fever has 2 type groups. One is the uncomplicated and another one is the severe group. Let's see what is the uncomplicated and then next what is the severe. So dengue hemorrhagic fever was subdivided into the grade 1 to grade 4. Let's see what is grade 1. In grade 1, the patient presents only the easy bruising and the positive tourniquet signs with someone with the fever. So here in grade 1 fever, and the patient is having the fever. In addition, positive tourniquet signs. And in grade 2, the presence of spontaneous bleeding into the skin and elsewhere. Somewhere the patient is having the bleeding. So when we are seeing the grade 3, the patient is having the classical evidence of shock. Grade 4, the severe and blood pressure pulse cannot be detected. So here the already we know what is happening in the dengue fever. So already I explained about the critical phase, febrile phase, and then recovery phase. So here also the patient is experiencing the shock syndrome. Grade 3 and grade 4 about that is called the dengue shock syndrome. I think you people understand about the phases of dengue. And next, diagnostic evaluation is very important. So here the diagnostic of dengue is typically made up of the basis on the patient symptoms reported by the for example, we have to do the physical examination. When we are doing the physical examination, it comes to know patient whether the patient is having petechiae, purpura, whether they having any bleeding there, we can observe the patient. Followed by the apply, especially the endemic area, we have to collect the history from the patient whether they having any infected patient nearby their hometown, by any viral infections. And the next we have to do the laboratory investigation. In that laboratory investigation, we have to do the WBC count, and then low platelet, we have to check whether the patient is having platelet normal platelet count, and here they already said that the patient is having low platelet count. And then severe disease plasma leakage result in the hematocrit level will be increased, and the hypoalbuminemia and pleural effusions, because already I said in fluid changes from the intracellular extracellular fluid exchange will be there, so that the patients may experience the pleural effusion. So once they have in the pleural effusion, patients may experience the dyspnea, and some patients may have in the dengue shock syndrome, nausea and vomiting, a rash, pain, and positive tourniquet sign, and other warning signs such as then warning signs someone who's living in the endemic area. Warning signs typically occur before onset of the severe dengue. The tourniquet sign, particularly useful setting where there is no laboratory investigation readily available, involves the application of blood pressure cuff on the 5 minutes, followed by counting petechial hemorrhage, high number of mixed diagnosis the dengue. So here we have to apply the BP cuff over the patient hands, and then we wait for a few minutes. There is the petechiae we can see in the patient hands, so which indicate the patient is having positive tourniquet sign. So in addition, we have to do dengue serology testing, the test of virus specific antibodies like IgG, IgM, and can be detect the dengue. And differential diagnosis, here we have to do the chikungunya test, we have to do dengue malarial test, leptospirosis, and then typhoid fever, meningococcal disease. These are the investigation. In addition, we have to do whether the patient is infected with the other, particularly malaria and then meningococcal fever. These are the investigation we have to do. Next, very important about the management. So when we are seeing the management, first it's all about the oral rehydration therapy, intravenous fluid, and then blood transfusion is necessary at here. And next, so how we are prevent the disease? There is no approved vaccines for the dengue fever. Prevention thus depend upon the control and the protection from the bites of the mosquito and transmission it. So we can, there is no vaccine for dengue, only we can prevent. The World Health Organization recommended integrated vector control program, advocacy, social mobilization, and legislation ensure the public health bodies, community, and strengthen the collaboration between the health and other sector, private and the public health. We have to collaborate with the people, and an integrated approach to the disease control, evidence-based decision ensure the intervention of the targeted approach and capacity to building to ensure the adequate response to the local situations. These are the things that has been done by the WHO. Primarily method controlling Aedes aegypti, eliminating the habituals. This is done emptying the contents of water by adding insecticides and then biological control agents to the area. So those are, if they have in the suspected group, we have to control the pesticides, and then primarily method control. Here we are insecticides and then biological agent we are using for the reducing open collections of water through the environmental modification. We have to avoid the open collection of water, and then people can prevent mosquito bites to wearing the clothing full cover the skin, using the mosquito netting while resting, and application of the insect repellent we can use. So, and then in nursing responsibility, we have to monitor the intravenous fluid, hydration fluid, so 1 or 2 days, and there is the patient is required more hydration, so we have to provide the IV fluid. The rate of fluid of administration urinary output 0.5 to 1 ml per kg per hour. Stable vital signs, normalization of the hematocrit. And the invasive medical procedures such as the nasogastric intubation, NG-tube intubation, intramuscular injections, and then arterial puncture or avoid minimize. So here we have to be, as a nurse, we have to avoid this intubation. Why? Because of there is a bleeding may cause when we are administering. Even we tell them to avoid the brushing also. So it may cause when they are brushing, it may cause bleeding over the gum, bleeding they can experience. So tell them to avoid the brushing also. Blood transfusion is necessary. Paracetamol, acetaminophen, fever, discomfort, NSAID might aggravate the risk of bleeding. So here we have to avoid the NSAID, non-steroidal anti-inflammatory drugs we have to avoid on here. Blood transfusion if necessary we have to transmit. And then prevention of dengue require control the eradication of mosquitoes carrying the virus that causes the dengue. So entirely the mosquitoes only carrying the virus, so we have to avoid the mosquitoes, so we can prevent the dengue. And then Aedes mosquitoes usually bite during the day, therefore special precautions should be taken during the early morning hours before daybreak and the late afternoon break. It's made dark, so I think people have to understand mosquito that will Aedes mosquito that will be bite on the morning time. Eliminate stagnant water and then serve as a mosquito breeding site at home. So stagnant of water we have to avoid nearby our home city. And then using mosquito nets at home, patient needs to keep under the mosquito netting. So we have to keep the patient in mosquito netting. Avoid the overcrowd. Dengue awareness program we have to conduct our neighborhoods, and then advise the patient to check up for the if they have early symptoms, we can prevent the complicated symptoms. So we early as soon as they have to consult with the doctor. And then these are about the dengue. I think people are understand about the dengue, how it's transmitted one to other, what are the stages of dengue, what are the classical signs, what are the diagnostic, everything we, and what are the mainly we saw about the management. I think people are understand about the dengue. Thank you.